Assalamu alaikum. Today we start our lecture from vasculitis. I try to explain the different category of the vasculitis. The classification of vasculitis according to the type of, like the main thing, the size of the vessel. According to size of vessel, the inflammation involves large arteries, the large artery vessels, the large vessels vasculitis. The inflammation involving the medium size vessels, the inflammation of the vessel at a small level, the small vessel vasculitis. Small vessel vasculitis. There are three different categories. This classification is an important classification. It's very easy to understand the different category of the vasculitis by the involvement of the different category of the vessel. And the patient presentation, the large vessel vasculitis, medium-sized vessel vasculitis, small vessel vasculitis, and the clinical feature, the patient presenting what type of clinical feature is also a bit different. So how the features are different, it depends upon what type of vessel is involved. What type of vessel is involved? What type of vessel? Like the vessel that related with which system of the body? The vessel affecting the liver, vessels involved the lungs or not, the vessel present inside the kidney involved or not, like this. So what type of vessel involved? So clinical presentation, it depends upon what type of vessel involved. The vasculitis, another very typical finding related with the vasculitis, we having granuloma or not. The granuloma presence or absence. Granuloma. The some type vasculitis, we have the granuloma or granuloma present there, and sometimes this granuloma is not present there, or the granuloma is negative. And the granuloma present or not. Another thing, the vessel having necrotizing inflammation. Another feature, the vessel is described like the vessel having the feature. What type of inflammation there? That inflammation involves the granuloma or not. Inflammation causing fibrinoid necrosis. Inflammation lead to fibrinoid necrosis. In one type, we're having fibrinoid necrosis. It's a necrotizing inflammation. Fibrinoid necrosis there. It's a necrotizing vasculitis. The necrotizing vasculitis, one very famous type vasculitis. That vasculitis known as Polyarteritis nodosa. Later we discuss this type in the medium category. When we discuss about the medium-sized vasculitis, the Polyarteritis nodosa. And the fibrinoid necrosis. Another thing, to differentiate these type of vasculitis from each other, we need our lab investigation. We try to find out that any specific serum marker present or not there. So very typical feature of the vasculitis, some vasculitis, they having the ANCA antibody. This ANCA antibody, the two ANCA antibody, one present in the cytosol, one present around the nucleus. The cytosolic, the P ANCA and the C ANCA. C ANCA and P ANCA. The two category of the ANCA. What are the ANCA? The anti-neutrophilic cytoplasmic antibody. So this antibody is the antibody. It's the antibody against the neutrophil. Against neutrophil, the substances, the chemical present inside, some proteins present inside the cytosol around the nucleus, and these antibody. There's some category of vasculitis, they having this ANCA positive, and other category maybe the ANCA is a negative. So these three main features, we try to differentiate these vasculitis from each other. The vessel having granuloma, granulomatous inflammation not. The vessel have granuloma not after inflammation. The tissue, the damaged tissue, or they have necrosis pattern there. What type necrosis there? And they having in the blood serum we have the ANCON knot. Okay, the first we discuss about the large vessel vasculitis. First we talk about the large vessel vasculitis. The large vessel vasculitis, the main two vasculitis, the first is your temporal arteritis. Temporal arteritis. Large vessel vasculitis, temporal arteritis. And the second type is the Takayasu. The name a bit strange. This type of name, it's Asian people have these large vessel vasculitis, mostly the Japan. This disease discovered there, Takayasu arteritis, is known as Takayasu arteritis. These two arteritis, temporal giant cell temporal arteritis and Takayasu arteritis. So these two arteritis involve large vessel. Now question here, so which area, what type of large vessel here? We draw here simple large vessel. Large vessels we discuss about. I just writing a short form. The large vessel vasculitis. The large vessel. We're having large vessel vasculitis. Large vessel vasculitis. The two category. One is the giant cell. Not the complete name here. Giant cell temporal. This vasculitis having giant cells there. Giant cell temporal arteritis. In giant cell temporal arteritis, we're having giant cell. So these two large vessel vasculitis, in one is giant cell and second one is Takayasu. In both arteritis, granuloma is positive. So it's a granulomatous inflammation. The granulomatous inflammation of large vessel. And what type of large vessel? A large vessel, for example, here is simple heart here. The types of large vessel is aorta, and the aorta giving branches here, carotid and subclavian. So aorta here is the heart here. So ascending aorta, arch of aorta. Giant cell arteritis. The giant cell arteritis is a carotid system. The subclavian artery and the carotid, a brachiocephalic trunk. Here we having second branch, the subclavian artery, as external carotid artery, internal carotid artery is a carotid artery. The left side carotid artery change to internal carotid and external carotid. This is a left subclavian artery is going to upper limb. And the large vessel vasculitis, the giant cell vasculitis, involving this artery, this vasculitis. This is a carotid system. It's a carotid artery. It's also a carotid artery. Large vessel in the giant category. Here we have the inflammation here, the brachiocephalic trunk, the inflammation of the carotid artery, external carotid or internal carotid. The inflammation of the carotid arteries. The inflammation, the granulomatous inflammation present inside the carotid artery. The giant cell. Giant cell is a giant cell temporal arteritis. The disease process here, this disease spreading to it involved one branch of external carotid artery, superficial temporal artery. That's why the patient having the headache is the typical feature of the giant cell arteritis, temporal arteritis. So this vessel, temporal artery, is affected mostly. And these patients, the ophthalmic artery is also branch of carotid system, and the sometime involvement of ophthalmic artery. These patients, they having the one issue, they have the headache. The second issue, they have irreversible blindness because involvement of ophthalmic artery. So these two issues in the giant cell arteritis. And what the issue inside the Takayasu, where the Takayasu is? Takayasu involve the arch of aorta. Takayasu vasculitis, Takayasu arteritis. Takayasu involve the arch of aorta. So arch of aorta giving branches. The arch of aorta. Mainly the branch affected, it can lead to the narrowing of these branches. Carotid also, affecting carotid system, also affecting subclavian system. The Takayasu is mainly affecting the subclavian artery system, the upper limb, This artery change to subclavian, then axillary, then brachial, then ulnar and radial artery. So these arteries going to upper limb. In Takayasu arteritis, the inflammation involves the branching point of arch of aorta. The arch of aorta gives the branches. So when inflammation is the granulomatous inflammation, granulomatous inflammation lead to the narrowing of the lumen. The narrowing of the lumen there, after the narrowing, what happened with the upper limb? The upper limb, the pulses become weak, very weak. The pulses are very weak pulses there. So in Takayasu arteritis, so Takayasu, another name for Takayasu arteritis is also known as pulseless disease. This disease is also known as the pulseless disease. The pathology in Takayasu arteritis is in the arch of aorta. Takayasu arteritis may have some like the headache issue there, involving external carotid vessels or some ocular problem there, but rarely. It's affecting mainly the upper limb branches. The upper limb branches, the branching point, the blood vessel going to the upper limb is affected first in the Takayasu arteritis. The giant cell arteritis is also another type of large vessel vasculitis. In this vasculitis involving carotid arteries. Giant cell arteritis. The giant cell arteritis easily involve the temporal artery effect. The poorly affect carotid system, not arch of aorta. Giant cell is for carotid system, and Takayasu for arch of aorta. So Takayasu arteritis is also known as pulseless disease. So these both category of arteritis, what the age of the patient, these both category of arteritis are mostly the common in elder person. The giant cell arteritis, the more elder the age is greater than 40 or 50 year age. And this arteritis, the age is close to a bit less than 40 or 50. This is the age. And these both giant cell arteritis are a bit common in women, a bit elder women, they're having the headache and some blindness issue, and upper limb vessels are weak. Upper limb vessel, the pulse a bit weak. It's a pulseless disease. The Takayasu arteritis, the second name for the Takayasu arteritis is arteritis also known as the pulseless disease. Pulseless disease. I already explained why it's a pulseless disease, because the branching point is affected here. The subclavian artery and narrowing of the lumen, it leads to decrease perfusion here. The perfusion pressure decrease, it leads to the weakness of the pulse. So the pulses are weak, or it's maybe not palpable, the pulse not palpable, can't feel, or it's a pulseless disease. So Takayasu arteritis is a pulseless disease. The giant cell arteritis, it leads to permanent blindness because it's affecting the ophthalmic artery. Involve the temporal artery, also affecting ophthalmic artery. This is all about the large vessel vasculitis. In the next coming lecture, we will discuss about the second category, the medium-sized vessel vasculitis.